Hi, welcome to Socialpost Health Channel viewers. I am Dr. Chava Anjaneyulu, Senior Consultant ENT Surgeon from Asian ENT Care Center located in Panjagutta, Hyderabad. Asian ENT Care Center is having complete solution, both diagnostic and therapeutic, for ear, nose, throat problems, vertigo problem, tinnitus problem, hearing loss problem, voice problem, and snoring problem. Now as the summer is coming and the temperature is rising, many people suffer with the nasal bleeding. This we call it as a epistaxis. Epistaxis means bleeding from the nasal cavity. Especially children, they have more problem of the nasal bleeding. Parents will come with the history of recurrent nasal bleed, sometimes daytime, sometimes nighttime, sometimes in school they will have bleeding and the patient become panic. And the parents and teachers also become panic. Panic itself increases again the bleeding because blood pressure will rise, pulse rate will rise, and bleeding increase. Commonly in children, this is due to the mucosa which is soft and blood vessels, underlying blood vessels. Whenever children exposed to the dry hot weather, if they play in dry weather, if they go to hot, very hot weather in the afternoon times, their mucosa will become dry and crust form, especially anterior part of the nasal septum. That we call it as a little's area. Blood vessels, especially arteries, anastomos. Even small scratch on the mucosa, if you see sudden head movements whenever fall, nasal bleeding will happen. This is mainly because the blood vessels are very superficial and those are arteries. So whenever you expose to the hot weather, that front mucosa become dry and crust forms. When the mucosa is dry and crust forms, usually children will have the itching and discomfort problem. With itching, they will try to clean or pick that area with the finger. Then the mucosa will damage and from there the bleeding will start. After some time, as coagulation happens, that bleeding will stop. But patient will have recurrent attacks, especially in summer, once in 2 days, daily or once in a week. This happens. Whenever children has recurrent nasal bleed, always we have to do nasal endoscopic evaluation, mainly to check the site of the bleed and number of bleeders, any abnormalities like prominent blood vessels or any hematomas, hemangiomas, rarely tumors also. Especially patient has adenoid problem with mouth breathing, recurrent cold, they have more chance of the nasal bleeding. So if the child has nasal bleed, bring the child to the ENT doctor at the same time. Because if you bring the child immediately, ENT doctor will easily see the site of bleeding with nasal endoscopic evaluation. If we see the bleed, then it is easy to coagulate that area with the chemical cartridge, either trichloroacetic acid or silver nitrate. It is very simple procedure. Once you coagulate that blood vessels, most of the times it will not bleed. The main precautions we have to take is, in summer we have to flush the nose with water every half an hour to 1 hour. So keep the mucosa moist, don't make it dry. And we should ask the children, don't poke the nose with the fingers and you cut the nails, don't increase the length of the nails or size of the nails. So avoiding picking of the nose and frequent water flush into the nose will reduce the chances of the nasal bleeding. If nasal bleed happens also, it is very small, it is easy to correct. Go to the ENT doctor, get the chemical cauterization of bleeding point. If you have any nasal bleeding, either in children, adults or elder people, contact Asian ENT Care Center. They do necessary investigation, especially nasal endoscopic evaluation. They find the reason, they do the needy treatment to the patient. Further updates, subscribe Socialpost Health Channel, YouTube.